children don't come in to a session saying, you know, I think I need to work on my stepfather who abused me today. Never, you know. And so it's up to the therapist to sort of plan when to include that, when to suggest that that might be something to deal with. And we pay attention with children more to experience. You know, Gestalt therapy talks about helping people become aware of what they do and how they do it in order for them to make choices.
Like to be present, to live in the present.
Yes, with children actually do live in the present a lot. But rather than becoming aware so much of what they do, it's a matter of providing the experience for them to experience either how they are operating in the world, and we do it through a lot of art medium.
You provide experiments too. I mean, you prescribe experiments.
Yes, experiments, and also to experience parts of themselves perhaps that they have cut away, that they've lost or cut off.
Can you set that up for our viewers about what they would be looking for in this interview?
What?
What our viewers would be looking for, what they might look for in this interview about your work, what you're doing.
Well, I think that Blake is a boy who tries hard to please and is somewhat has some difficulty in expressing himself, his angry feelings, particularly toward his father. And I think that, and he does, as he said, you know, fight a lot with his mother. But you'll see that in the film. But I don't think that when he fights with her, I don't think he's really expressing what he's really feeling, which I think he did in the film. I think we could look for that.
So we're going to watch in this interview how you help him to get more in touch with how he feels.
Really, and we talked a lot about what he could do when he feels angry, because that's what happens. He gets, he pushes it down, and then he comes home and he acts out, fights with his mother.
So there is a behavioral component too.
Yes, yeah.
Well, let's watch how you did it.
Okay.